Board of Commissioners meeting. We have one attending by telephone because of medical reasons this morning. Good morning, Mr. Edge.
Good morning.
Thank you for joining us this morning. We will have the invocation by Commissioner Keefe, followed by the pledge.
Thank you. If you please rise. Dear Lord, grant us the wisdom to do the business of all thy people with compassion for our community and passion for our citizens. Protect those in harm's way who protect us and serve us and all of our nation. In your name we pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Madam Manager,
Yes, ma'am.
we have the approval of the agenda, and I think we have a correction on the consent agenda.
A correction on the consent agenda.
I was going to make a change. Ask for
All right. Approve this application. Those in favor? Mr. Edge?
Yes.
Unanimous.
Thank you.
Thank you.
Madam Chair, I'd like to ask that we move to item number 5. We have some members from the Alliance Behavioral Health Care that may be in traffic or looking for a parking place. So if we could we move to item 5, which is a presentation by Mark Colbreth of the Cumberland County School System on the Reading Rocks program.
Okay, thank you. I think Mr. Colbert would be happy to go and complete that item. Good
Yes, ma'am.
morning.
Madam Chair, good morning. Commissioners, good morning. I'm Mark Colbert, I'm Director of School Support with Cumberland County Schools, and just wanted to come out and invite all of you again to our Reading Rocks function. That'll be a week from this Saturday, October 18th, at Festival Park. The walk will start at 9, but the events will start about 8:30 for us recognizing the schools. And you know, all the money that we raise for this goes right back to the schools to support our literacy efforts. But we'd be honored to have you there. We'll have, there's information in the letter that I've provided where if you'll call and let us know, we'll provide VIP parking for you and also an agenda so that you'll know about how this event will go. And it'll start about 8:30 in the morning. But we've had tens of thousands of folks show up over the years, and we'd love to count you in that number if you were able to come.
Thank you so much. That's a walk that has really grown over the years.
It really has, yes, ma'am.
Thank you. Thank you so much. To the clerk, please. We appreciate it.
Madam Chair, if we could move to item number 6, which is reconsideration of an economic development incentive agreement with MBM Hospitality. And I would ask our attorney, Mr. Moorfield, to review this item.
Madam Chair, Commissioners, this, back on, in September 2010, this board approved, after a public hearing, its first economic development. First economic development incentives agreement for MBM Hospitality. That was for the Embassy Suites Hotel built over on the other side of Fayetteville. The agreement was prepared in March of 2011 and submitted to Bo Gregory at the Chamber of Commerce. I followed up with Mr. Gregory for several weeks with emails about getting this agreement back and just never heard anything from him. And some point that year is when he left the chamber. I know that the MBM agreement was signed with the city. It was a slightly different agreement with the city than it was with the county. I think there was some delay in getting the signature from the city, but there is an agreement in place with the city. This year, Mr. Mehta, the managing member of MBM, contacted me, I think directly first, and asked how he went about getting his incentive. The first incentive for 2013 would have been paid in 2014. I explained to him we never got an agreement. There was no agreement, so he would not be able to get an incentive. Mr. Richard Wiggins is the attorney representing MBM, and he's present to answer any questions or make any further comments. But in my discussions with Mr. Mehta and then with Mr. Wiggins, we went over everything that had happened with this. I prepared in my memo a chart, a little chart there at the bottom of the page for the commissioners to kind of summarize the key changes in what they are now requesting as opposed to what was presented by the Chamber of Commerce, advertised, and public hearing was held on. They're wanting to add an affiliated corporation to be eligible for the incentives. The affiliated corporation actually owns the personal property in this hotel, and the agreement that I have proposed at this point would incorporate that by making the taxes that are paid on the personal property in the hotel owned by another entity subject to the grant back also. Thank you. The project is substantial, not substantial, but slight difference. The proposal had been at least 160 rooms with an 18,000 square foot conference facility. It's really 165 rooms with a 12,000 square foot conference facility. The jobs is where the real issue was. Mr. Wiggins says that it was their understanding all along, back then in 2010 with discussions with Chamber of Commerce, that these were only going to be, for the most part, part-time jobs. The agreement, or excuse me, the joint policy does not address part-time jobs. What was originally proposed in the public hearing was held on was 76 full-time jobs paying greater than the county median and 101 total full-time jobs for county residents. What we have ended up with in reality is 18 full-time jobs paying greater than the county median, which is $15 an hour, and 78 total full-time and part-time jobs. And I don't know what the breakdown is between full and part-time jobs, but if Mr. Wiggins can address that if that's a question. The investment that was proposed was $25 million. The agreement with the city, it was amended to be $22 million. That is not how much we have it assessed for on the books with the county, so that would have created a problem anyway. And frankly, the evaluation on this property is under appeal to the Property Tax Commission. So what we come up with, and it was my suggestion that it be not less than $15 million, because $15 million to $22 million or to $25 million is the one category of the criteria that is available in the joint policy. In looking at, if you recall, a month after this, SUS was the second agreement that was done. That agreement was handled in some way. I had some questions and issues with what had been proposed, and based on what Bo was telling me and what the companies were telling me. So again, that one was not prepared until March. That one came back in October of 2011 and was amended, and it was a substantial reduction in both the jobs and investment. And I know with respect to SUS, I never had any contact with MBM's companies, but with respect to SUS, with the company reps, they told me they had never talked in terms of the numbers that was advertised and was proposed, and didn't realize the significance of it. That did not become a problem, because I think SUS, I'm not sure they're even still in business, but they never requested an incentive anyway. So, but there was an agreement in place with them that was a substantial amendment and reduction to the proposal. They never signed the first agreement either. So this is where we're at now. That MBM is asking to keep the incentives payment back at the same thing as would be a level 2 under the incentives policy, which is commences at 65% of a grant back the first year, down to I think 50% in the 5th year. The city's agreement actually starts at 70% and goes down to 50% in the 5th year. There's not any under the proposal we have now, this agreement, they would not qualify under the criteria that the joint policy. I mean, they're around 34 points, and you have to have 50 points to qualify. But I would point out to the board, of the 5 incentive agreements that have been done since the policy was adopted in June 2010, none have qualified under the joint policy. But we've offered incentives for all those. So that's I think probably more of a problem with the policy than with the agreements themselves. But in any event, that's where we're at. There is no existing agreement because it was never signed by the other side. It was signed by then Chair Kenneth Edge and delivered. and I just never got a response. I know what happened with SUS, didn't know what happened with this one until this year, but the changes that are to be made or proposed to be made from what was proposed in 2010 are highlighted in yellow and green on the draft that's in your agenda package. And just, I'd ask if the board wants to hear from Mr. Wiggins to address any questions or issues with this. He's present right there in the front row.
My questions are not for Mr. Wiggins. Attorney Wiggins, I think, for those of you in the audience, we are talking about an Embassy Suites that is over on Lakeshore Drive.
Lake Valley, I think it is.
Lake Valley.
Valley Lake. One of the,
Lake, well, one of the lakes, but it's Embassy Suites. I have significant issues with this because the company didn't do what we thought it was going to do, and the 18 full-time jobs compared to 76. I don't think we stuttered on that or stumbled.
Chair, there's no question in my mind, because the way I do the advertising these, I send the form to the Chamber of Commerce and they fill in the numbers. So that's what was presented to the Board of Commissioners.
And then $10 million less?
The reason I suggested 15 is because it appears to me, both SSU and this one, but since we're just talking about this, I'll address this one. If you go through the criteria, there are different levels of investment, different levels of jobs that pay above the median wage. There's a group of criteria, several criteria set in the policy. The criteria were selected so this would qualify for a level 2 incentives deal. And it appears to me to have been arbitrary because they were not related to reality at all. And the reason there was such a delay in getting this agreement back was because I was incredulous that a motel would create 78 jobs paying over $15 an hour, or this number of jobs. I mean, just from past experience representing people who develop hotels, it seemed a little steep. The actual investment, the city's agreement says $22 million. The county currently has the property on the books at about $18 million. It is under appeal to the Property Tax Commission for something in the $15 million range. I think they're saying the real property is $14 million. There's some issue about how the personal properties will be added back into it. I've explained to Mr. Wiggins that it is critical to make sure this agreement addresses what they actually have in place, because we don't just write a check. The county doesn't just write a check for incentives. When someone comes in for incentives, they have to demonstrate to the financial auditor that they have complied with the jobs created, with the investment. The investment is pretty easy, because we do that, the tax evaluation on that. That's what the investment is. It's the increase in taxable investment. The jobs are really pretty easy to deal with, because you can follow through the federal and state employment reporting forms and see what the number of jobs are and figure out what the average wage is. I mean, it's not hard to do. So, I mean, these companies, I mean, I'm not sure that everyone in the past has understood that it's not just a giveaway program. They have to demonstrate that they have met the criteria that the board has established for the incentive, and so that's where we're at.
All right. I have more questions, but I'll go to the board. Mr. Fairclough.
Madam Chair, I have a lot of questions too. It's not necessarily about this project. I think our dealing with the Sanderson Farms issue has brought up several questions about the whole way we do financial incentives. And I think probably, as I've probably mentioned to everybody here, that it'd be my desire that we go back and revisit exactly how we do those things. And I suggest that we just go ahead and refer this to the policy committee to look at in some more detail, and probably it wouldn't be a bad idea to look at our whole policy and how we do it. You know, if you got more questions, you want to go ahead and ask those at this time, you can do that.
Is that a motion?
Well, why don't we go ahead and ask whatever questions we've got at this point, and then I will gladly make a motion to refer it to the policy committee.
Mr. Evans.
Thank you, Madam Chair. Mr. Attorney,
Yes, sir.
I want to go back to this incentive package because, as my colleague alluded to, we've been talking about incentive packages and whatnot, dealing with Sanderson and all this stuff. In this with this incentive package, as far as the jobs are concerned, first of all, this was presented to this company by whom?
The chamber, at that time, Bo Gregory was the economic developer at the Chamber of Commerce.
Who was part of the Chamber of
Yes, sir.
Commerce? Okay. So the number of jobs that we were asking them to provide, that number came from where?
Those were Bo Gregory's numbers.
Those were Bo Gregory's numbers.
Yes, sir.
Who worked.
Well,
for
I
the-
mean, that's where I got them from.
Okay.
How he derived them, I can't say, but that's where,
Okay.
that's how they got in this agreement.
So the numbers that were given to them to hire how many full-time employees?
The total number of jobs to be created in the county was 100, and for county residents was 101. That was full-time jobs is what's addressed by the policy. What they understood, and what they say they were told, and I think there must be some validity to that because the city agreement actually addresses full-time and part-time jobs. But it wasn't 101, it was some number less, whatever I've got in there, 76, I believe. I think the city agreement still says the original numbers, but it's full and part-time jobs.
Okay, so it's 100 and,
What was
it was
presented,
proposed 100 and what jobs? How many jobs?
to the Board of Commissioners, 101 full-time jobs for county residents. Now, that's without reference to any wage or salary. That could have been minimum wage, but that was that. But included in that was 76 jobs that paid more than the county median.
Okay. And so how many jobs have they produced at this point?
They have produced, according to Mr. Wiggins, a total of 78 full and part-time jobs for county residents. 18 of those jobs pay more than $15 an hour, and are full-time jobs that pay more than $15 an hour. And more of them may be full-time jobs. I don't know the exact number. I know that they're saying 18 are full-time jobs paying 15, and there's a total of 78 part-time and full-time jobs.
Okay. Okay.
All right, are there other questions?
I've got a quick question, Madam Chair. As chairman of the policy committee, I want to understand what the desire of the board is before we bring this to policy, if it gets approved. Are we looking for a retroactive policy on this one, or are we looking for new policy moving forward?
Well, this will be an actual, these folks are seeking an agreement that will be effective for the year 2013. They're expecting or requesting an incentive payment for 2013 that would be paid upon proving that they have complied with whatever the agreement is. Right now, there is no agreement.
Okay, but in your opinion as the attorney, even if we were to look at our entire incentive package and move forward, that the one currently right now for MBH does not qualify as we described it, and we would have to make changes and go retroactive to them.
Well, you'd have to do the same thing you've done for the other four.
Right.
They'd have to be proved outside the scope of the agreement. Some of these that have been presented to you, Sykes Industries, for instance, Sykes Industries was presented to you as not complying with the incentive policy. And that's fine, you approved it. The city, I'm not sure the city has yet, but the city had a real issue with the wage determination in that. So each one of these, although they are the basics, there's the same policy and basic same agreement, both from the cities and counties' policies, they diverge somewhat. There are little differences in them. And this one demonstrates, I mean, in this instance, the city has an agreement, and we never got an agreement. Sykes Industries, the city's agreement was quite divergent from what the county's was. And it's because of what was presented to the city council as opposed to what was presented to the county commissioners.
I believe the potential motion that we're talking about now is to address this issue and future incentive packages. So based on that information, can we roll up this particular issue in with that and come to a conclusion, do you believe?
You can do that, or you can handle this independently. This is one agreement for one company, and this is not speculative. We know what the job creation is. We know what the investment is.
Would you recommend that in two motions?
I would recommend that you consider this separately because I don't think you're going to come up with a policy that's going to address this. That's already
Thank you.
happened.
Thank you.
Now, don't get me wrong, you don't have to do it at this setting. You can certainly discuss this more fully in a
Sure.
policy committee, but I would not tie this into right now, this is not, I'm being quite frank with you, and Mr. Wiggins understands that, will acknowledge that. This does not comply with the policy. This never complied with the policy unless you used the numbers that were presented to us by the Chamber of Commerce. That's the reason I think my last comment in here was that, in my opinion, the numbers were contrived. I think the numbers have been contrived in all of them to get to a certain level.
Well, Madam Chair, if Mr. Wiggins, no sense in coming up today if we are going to send it to policy, and I'd love to hear the side, that position at policy if we go that way.
All right, and you're speaking of, it would be December,
November.
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 First week in
November.
November.
And Madam Chair, let me make sure I clarify. There's no doubt in my mind that the representatives for MBM in the discussions, I think Mr. Wiggins was involved in some of these discussions. I was not, but there's no doubt in my mind, they were told these things in terms of the incentive and the way this thing applied. And I think that's validated by the fact that the city, in fact, does have an agreement with them which uses part-time and full-time jobs.
Okay.
You ready for a motion?
All right, all right.
Madam Chair, at this time, I would, oh, I'm sorry, Bill.
I want to hear from Mr. Wiggins, if that's possible.
Let's wait appeal policy.
Okay, well, I
Seriously,
mean,
seriously, let's just wait a policy.
I would appreciate it.
I have one more question. So what we're talking about doing now is taking all of this and rolling it all into one thing and taking everything back to policy instead of dealing with this situation right now and take it back to policy and deal with everything together? Is that what you're talking about doing?
I'll make a motion right now, and you can discuss it however you
Alright.
want to.
Okay.
Let's have the motion.
I move that we refer item
6.
item 6 to the policy committee for further consideration.
Second.
All right, you've heard the motion. Yes,
Yes,
Mr.
sir.
Edge?
My question about the going back to policy, are we going back to change the policy, or are we going back to review the conditions of this one?
My motion is just to refer item 6. Ken, if we want policy committee to just look at our overall policy, you can make that a separate agenda item for the policy committee, or the policy committee can do that.
Well, I don't think there's any doubt about the fact that this project is way short of qualifying for the number of jobs and the capital investment, from the way it sounds to me. So I think that should be a point of discussion if it goes back to policy, is what are we going to do about this one? Because we're going to have to do something about it, but I don't think we can pay something if they haven't lived up to their part of the bargain of creating the jobs and or making the capital investment, which is way short from what I understand of where it should be.
Mr. Edge, and confounding this further is the fact that, do we go back and change the policy for the incentive package for the others that also didn't qualify? We approved them, and they didn't qualify. Okay.
Madam Chair, I would just submit on that it's within the purview of this board to tweak its own policy. And if we're interested in extending incentives, we can go around our policy and tweak it. You know, we can do that. I mean, we're not violating anything except what we decided to do. But if I'm understanding the county attorney correctly.
That's correct, Mr. Faircloth. The policy actually has a revision in it that the final decision is the governing board for both city and county
Is
regardless,
us.
the
All right.
policy or guidelines.
Exactly, but what I want to do, I want the policy committee to discuss this project and decide if we're going to provide these incentives and you know, and how things have come about, what we were told before, and what the reality is. You know, that's what my concern is. So,
All right. I'm going to call the question on this issue then. Can I do that? All right. Let's vote on referring this to policy committee or not. You've heard the motion. Those in favor?
Voting in favor, Commissioners Melvin, Council, Faircloth, Keith. Voting in opposition, Commissioners Evans, King. Commissioner Edge, your vote, please.
I'll vote yes.
Thank you.
All right, thank you. It is referred to policy. Let's go back now.
Madam Chair, if we
Madam-
could go back to item number 4, I'd like to introduce Mr. Hank Debnam. He's the Director of the Local Operations of Alliance Behavioral Health Care.
Good morning, Mr. Debnam. Monday mornings are a tough time to try to find a parking place.
Yes, they are. Thank you, Madam Chair, and members of the Board of Commissioners. I am Hank Dedham, the Cumberland County Site Director for Alliance Behavioral Health Care. And I have, Rob sends his regrets. He's basically doing the same thing in Johnson County. But I do have 2 of our corporate leadership members here. Ann Oshel, who is the Chief of Community Relations, and Sean Schreiber, who is the Chief of Clinical Services. And they're going to give you an overview and update.
Thank you. Welcome. I'm sure you've had your workout already this morning in trying to find a parking place.
We did. Good morning.
I am
And
so sorry.
we do apologize for being late. Took the scenic route in and then tried to find parking, so we apologize. But anyway, County Manager Cannon, Assistant County Manager Lawson, Madam Chairman and Commissioners, thank you very much for the opportunity this morning to stand before you and give you just a brief overview of some of the operations at Alliance and an update. We'd also really like to thank you for your support of Alliance. Your generous contribution of county funding allows us to partner and expand and improve services in the community, and for that we're very thankful. We'd also like to thank you for your support of Alliance and generally the public mental health system by agreeing to put us on your legislative agenda for the year. So we appreciate that. I'd also like to additionally thank Commissioner Edge, who's a member of our
He's
board,
backbone.
and who's seen out here today, for his ongoing support. He's been a great support to us, a leader, and really a cheerleader for our staff during kind of some difficult transitions over the last year. So we significantly appreciate that. Lastly, Rob Robinson, our CEO, was not able to be here this morning and wanted us to send his regrets. As it turned out, there are several of these events scheduled this morning, so hopefully Ann and I can do a reasonable job filling in. Anyway, if I can get to slide 1. So Alliance is a behavioral health managed care entity that oversees the delivery of services in Cumberland and those 3 other counties. Durham, Wake, and Johnson County. In that role, we're responsible for developing a network of services that ensure individuals who are on Medicaid and who have no insurance or are considered indigent have access to medically needed services, from an array of crisis services that are available within 2 hours of someone's call for need, to outpatient services, psychiatric services, residential, and a broad range of community services. Additionally, we're responsible for over 180,000 Medicaid-covered lives, and the total population area, as you can see, is 1.7 million. Cumberland County comprises our 2nd largest number of Medicaid eligibles in the area we serve. Some of the functions of Alliance as a managed care entity beyond establishing a network is paying claims. So any Medicaid provider or provider who offers any service, we're responsible to pay their claims, to authorize services, to develop a network that ensures both geographical and timely access. And also we have a special obligation under this Medicaid waiver, which is to provide coordinated care for individuals who are considered more vulnerable and special needs, individuals who tend to access crisis services and residential services often, and who may be vulnerable to fall through the cracks in the system. Our authority comes from the 1915 BC waiver, which in short really means that CMS basically gives a state permission to waive some of the standard Medicaid rules in exchange for us offering enhanced quality of service and keeping those services in line or below the typical fee-for-service structure. So that's our responsibility. In view of that, we have to be kind of heavily regulated and have to report out on a wide variety of standards that Ms. Osha will be discussing. The C waiver refers to something called innovations, or is actually the home and community supports waiver. That's intended for individuals who functionally have an intellectual and developmental disability and would require to live in an institutional setting unless there were supports and services allowing them to be in the community. Roughly 1,800 individuals in total Alliance catchment area receive these waiver services, and they're shared proportionally among the 4 counties. Unfortunately, there's not much funding to serve that population, and we also operate a waiting list. So typically, we have as many people receiving those services as we do waiting for those services, and that would be the case in Cumberland as well. So just a brief timeline of Alliance. Alliance was basically founded when a couple years ago in 2011, the state had decided, based on the success of the Cardinal Innovations Demonstration Waiver, that actually moving the state under a waiver would be beneficial and more cost effective. But that did call for a consolidation of MCOs. You had to manage a certain population size in order to successfully apply for a waiver. So the Durham Center partnered with Cumberland and Johnston to submit this proposal, and in fall of 2011, we were granted the ability to operate together under interlocal agreements. In July 2012, the Durham Center merged with Wake County to form Alliance. At the time, Wake County was actually interested in becoming their own waiver site. They had some issues that would not permit them to move forward on their own, and they looked to join Alliance. We began operating the Medicaid waiver in February of 2013. I think the big change of operating under a waiver is we took on a broad range of new responsibilities, but also a waiver is a capitated system. So we were at risk. We get a set dollars from Medicaid, just as we have from the state, and in some cases from the county, and we clearly have to manage within those budgets. So we had to put a lot of systems in place to be able to ensure that we were being good stewards of significant amounts of money. And then in July of 2013, based on the work that we had been doing in partnership with Cumberland, a merger was developed, and we were able and fortunate to merge with the Cumberland County LME as well. So I'm going to turn over to Ann to talk about some of our local presence.
Thank you, and again, we apologize for our tardiness. Like many of our staff at the local sites and even at our corporate level, most of us came from the world of LMEs. And so it was important as we transitioned to a managed care approach that we find that balance between kind of honoring the integrity of public mental health while at the same time operating under the conditions and statute of managed care and more of an insurance type approach. And we think that we have done that very well at Alliance. And we did not want to be one of those MCOs that operated everything behind a black curtain. We wanted the transparency and the visibility of the citizens that we serve in our local communities. And so while we do have our business functions that are in a centralized location in Durham, all of the major kind of operations and service delivery and quality happens through our local levels and funnels up to departments that are located in RTP. In particular, in Cumberland, we have care coordination that consists of mental health, substance abuse, and the IDD, developmental disability population. We have system of care, which we will talk more extensively about as we have kind of continued on the strong history in Cumberland of a system of care approach. The community relations, which is the departments that I oversee, and provider networks. We still maintain a local presence in both Cumberland and Johnston County just because there has been such a major transition for providers over the past year. Our funding is kind of a hodgepodge of 3 local sources of Medicaid. Clearly makes up more than 80% of our per member per month. We have received state funding, which is a little more than 11%. I'm sure that as you have kind of followed the General Assembly over the last several years, the mental health system has experienced some fairly major cuts to our state services, and for lots of reasons, but one of the big ones is because of those states, we have a great reliance on our county funding, which will sometimes supplement the cuts that have been made so that it doesn't actually impact kind of the capacity and the expansion of services. So we have a total operating budget of almost $445 million. Our staffing, I know when we first came to Cumberland, it was kind of a small but mighty workforce. The same was true in Durham. We now have over 300 staff, 200 of which work out of our corporate office, and we have about 40 staff that are here in Cumberland. So our managed care operations, and as I mentioned, I came from the LME world, and when I look at this, I am reminded of how far we have come in such a short amount of time. Most of what we do on this screen are things that have been a big learning curve for us as we operate kind of the responsibility of so much Medicaid dollars. There's certainly the administration, the leadership of Alliance. We have a 24/7 call center on average. We answer 7,000 to 10,000 calls a month, either for access to services or just information about local resources or crisis facilities. And those calls are all regardless of insurance. The care coordination efforts, several years ago, the General Assembly made a fairly kind of drastic decision to eliminate case management out of the service delivery. And so care coordination is not intended to take the place of case management by any means, but it's our responsibility to oversee the delivery of high quality services by our providers and ensure that kind of the people that we serve are getting what they need when they need it to the level that they need it. And that happens through our local care coordination. All the community relations, which I'd be happy to talk about all day, but since we don't have all day, we'll talk a little bit about that at the very end. Our utilization care management, which is where we authorize all of our services, compile our benefit package. And one of the major benefits of managed care is that we have some flexibility to our benefit package. And so we can do rate incentives for specialized services like trauma-focused care, enhancements to residential services, enhancement to providers who keep people out of the emergency department. Provider network management that Sean will talk a little bit about, our quality management, which is kind of where all of our data comes from, business operations, which is where clearly we pay claims, our financial hub, corporate compliance, which is our fraud and abuse allegations, and that we're in compliance with all of the many entities that oversee us, and our IT department, and then healthcare integration, which is kind of a sign of things to come with Medicaid reform. So we'll talk a little bit about our local providers.
So one of the big changes for being a Medicaid waiver is that, and I think this is one of the most important things, that we're actually able to develop, create, monitor, and improve the quality of a provider network. So every community had existing providers. When we went live, we were required by the kind of rules of our DMA contract that any provider who was offering service could be moved into our network, but then over time we could set criteria to basically select and improve our provider network. The main requirements are we have to have access, so we have to have geographical access. So for things like physician services, outpatient therapy, crisis services, you basically have to have those services available within a 30-mile radius of where most individuals live. Our crisis services have to be available to an individual within 2 hours of someone seeking a service. And general outpatient services have to be available within 14 days. We're also responsible to have a continuum. As Ann said, we are required to work really hard to keep people out of local emergency rooms and out of more costly inpatient stays. So we have a broad array of services that help us do that. And the big thing is, again, we have the ability to monitor and develop a network of providers that meet certain quality standards. So again, our focus has been on delivering not just good care, but cost-effective care, high quality, with a focus of keeping people in the community. One of those particular areas we've been successful is when Alliance began, we had one of the highest number of children just across the 4-county area in secure residential treatment, and many children getting these treatments out of state. As of this point today, we have less than half that number that when we started, and we have no children who are any place other than about 30 miles across the border getting these specialized services, which has been, I think, a huge improvement for us. So our current network, we have roughly 1,500 and some outpatient practices, which when you think of an outpatient practice, it's either a physician or social worker, psychologist, providing kind of routine counseling services. We have agencies that provide a number of services, from residential, working with children and family with homes, intersecting with kind of our more severe and chronic populations in the community, and then we have our hospitals as well. So again, year one, our focus was on just kind of bringing our network together. We're responsible to ensure the quality of that network. We're responsible to credential that network, which means we have to verify everyone who has experience, training, and education that they say. And then this year, really our focus on more expanding services, identifying gaps, and looking at quality. I think one of the areas I think we've been successful in expanding a gap is when Alliance merged with, or began their partnership with Cumberland. Cumberland County was still providing a number of behavioral health services. So we needed to go through a divestiture process, and Cape Fear Valley was able to assume most of those. Over the last year, they've significantly ramped up the services they're providing, culminating recently the addition of 2 child psychiatrists as well. So we believe that's a good example of that partnership between allowing Medicaid funds, county funds, and our state funds to come together to improve services and access. And another big move forward for us is promoting the use of evidence-based practice. Just like in medicine, there's certain standards that have been researched and determined to be more effective for treating certain disease states. That is also true with behavioral health services. There always hasn't been a big focus of moving that forward, and that's a big focus for Alliance. A first step of that was last year we did an RFP process where providers of certain services that we deemed really crucial to our system, intensive in-home services, an intensive substance abuse program for adults, and kind of something called community support team, which is a service that treats individuals with high crisis services. We were concerned about quality and the models they were using, so we put out an RFP across the whole Alliance network, which really helped us identify providers with the best practices, and they were able to maintain and stay within our network. So I'm going to turn it back to Ann just to kind of finish up by talking about how we use some of the local funds. Thank you.
So as Sean mentioned, a lot of what we have been able to accomplish both in the transition and as we look at kind of the vision, particularly in Cumberland for a mental health, substance abuse, and DD service that kind of penetrates everybody that needs to access the service and delivers a service that is meaningful to change. So Cumberland County contribution is about $4.8 million to our overall operations. Over half of that goes to support Cape Fear in the development of some of our crisis services. And I know we've all been kind of waiting that we have a fully operational 24/7 inpatient crisis stabilization program that also includes some 23-hour observation chairs. And there's several reasons that is an important ingredient. Most people access mental health substance abuse services while they're in crisis. They're encountered through law enforcement, through EMS, through the Sheriff's Department, and we very much want, along with our CIT partners, for Cumberland to have an alternative diversion to the EDs. And so we are close to that happening. We are meeting regularly now with Cape Fear on some of the regulatory requirements and the all-important involuntary commitment designation, which allows them to accept people as opposed to going to a psychiatric hospital. So we're hoping in the next couple of months that we are fully operational and implemented in our facilities. The remaining funds go to outpatient services, go to our PATH program, which is a street outreach program for people experiencing homelessness. They go for some specialized services, our multi-systemic therapy, which is a best practice service for children and adolescents that are involved in the Department of Juvenile Justice, and then some residential services. So that's kind of the majority of where the county funds are spent here in Cumberland. The other kind of importance to county funding is that we can supplement people who are uninsured or underinsured. And in Cumberland in particular, for those veterans or families that have TRICARE and either the service that they need is not offered through TRICARE, or they're choosing at this point not to go through Veteran Services. And of course, we have Hank, who is our veterans point of contact extraordinaire. Not only does he help with some of those case by case, but also to inform kind of the system in collaboration with TRICARE in terms of kind of what we should augment for people that aren't receiving what they need through that insurance type. And mostly it's to support people that have no benefits and are not Medicaid eligible and are either unemployed at this point or underemployed so that they can't purchase insurance through the health exchange. The integrated management of all funding sources, this is kind of our braided funding approach. That if there is a state cut, as there has been, to substance abuse services, we can look at how to supplement that reduction in state funding through the use of our county funding. And the integrated management of all disabilities. And so now, instead of kind of putting a percentage into mental health, putting a percentage into substance abuse, putting a percentage into developmental disabilities, we look at it comprehensively and are able to shift money to kind of the greatest need in our communities. We have kind of a joke that it seems like every 4 days somebody is auditing us for something. We are required by statute to submit 115 different reports to the Division of Mental Health and the Division of Medicaid Assistance in terms of our performance standards. And so both from our financial stability and how we pay providers to our penetration rates based on kind of the population size, how many people are accessing our services in a meaningful way. We have lots of reviews, our board and board finance committee. Commissioner Edge could certainly speak to that activity, our state and county reports, and then the multiple audits. We are URAC accredited in kind of all the areas that URAC does, and we have a full accreditation for 3 years, and not all MCOs have achieved that accomplishment. So lastly, we want to talk a little bit about our community programs here in Cumberland, and this is where the rubber hits the road for us in terms of some of the exciting work that's being done and, you know, the impact that it has on the citizens and our communities. So we have the 24/7, 365 crisis response and access to care. Within that, we have kind of, for anybody that answers the phone, we have a huge list of resources. So if somebody called from Cumberland and they were homeless, they were also in need of substance abuse services, we could on the phone refer them to the shelters. We could make some of those linkages while they're still on the phone. You know, we, of course, the people that call in crisis, we had a really unfortunate situation where a man was standing in the middle of the road here in Fort Bragg Boulevard. We were able to stay on the phone with him, transfer in the 911 system for a response while he was still standing in the middle of the road threatening suicide. We have a robust array of crisis services, both in terms of our mobile crisis response that diverts people out of the EDs and our state hospital systems, and then the facility-based crisis through Cape Fear. The transitional living program, and this is probably one of our exciting new services through My Over Reese. It's a 30-day substance abuse recovery program for people exiting the jail, crisis facilities that need a little longer time for assessment and recovery before we look at kind of employment and permanent housing for them. We have adult care review. We've had child care review. We now, in partnership with the Department of Social Services, offer this same kind of holistic community-based planning for adults who are high risk, going in and out of our jails, guardianship cases through DSS. We have our Independent Living Initiative program, which is kind of another one of the most exciting things that we do. My dream is to have billboards as we enter into all of our counties that says housing is a therapeutic intervention. It is really hard for people to stay compliant with their medication, to stay well, to access primary care when they're living under a bridge or we have a homeless family. So we have $200,000 in funds that we use for short-term rental assistance for people leaving homelessness or eviction prevention. The vast majority of that money is, the rate of spending in Cumberland County compared to the rate of spending for that program last year has almost quadrupled. So we are really kind of out there in the systems that have housing needs, working in conjunction with them to identify people that we should support through rental assistance. And then, of course, our veterans point of contact. And I think that we have just a couple more bullets too. Our DSS partnership initiative, over the last year, we have been meeting both with child and adult partners through DSS and through DJJ. There has been a higher number of young people going to the most secure residential treatment facilities called PRTFs. We have worked with DSS and DJJ and the court systems to develop a complex case protocol of kind of for kids in detention that are in custody of DSS, of how we can access services in a more timely way and make sure that in a wraparound planning way that we are providing for what they need as opposed to sending them out of the community. And then, of course, our transition age youth services. This is kind of a major point of emphasis for us. 50% of all serious mental illnesses have emerged by the age of 14, 75% of all major mental illnesses have emerged by the age of 24. We have a window of opportunity in that age range to do prevention services, early intervention. And so how do we partner with the school systems to identify at-risk students? You know, how are we co-located inside the detention centers, inside the jails, you know, to kind of recalculate people that might be on the wrong path. And just a couple of examples of Cumberland's support around this age group. We hosted the first ever statewide conference on transition age youth, on kind of now known as emerging adults. And there was a large presence and support from Cumberland. They sent all the young people in their LINKS program to this conference. We had a lot of community members and agency personnel that attended. We also have a large SAMHSA grant in Durham, and we are beginning to replicate some of those interventions. Cumberland has been the one that has kind of raised their hand and said, you know, we want in. And so last spring, we hosted a real-world simulation for young people that kind of takes them through a day in the life of how they choose their careers that has a livable wage. And we had over 40 young people in Cumberland participate in that real-world experience. And so there's many exciting things going on in terms of community programming and partnerships, and certainly some synergy and momentum around how to do things better. And I believe this is kind of a map of what may be to come, and we won't spend too much time on that other than to say in the long session, Medicaid reform and the consolidation of MCOs will be a major discussion point, which again is why we so much appreciate kind of your legislative agenda to support the system as it is currently. It will be incredibly disruptive to once again turn it on its ear. So this is the possibilities of where Alliance would be partnered with Sandhills.
Mm-hmm. We want to thank you for coming and thank Mr. Bostock, who is a member of your board, along with Commissioner Edge, who is attending by phone. We enjoyed your conference, those of us who attended. No, it wasn't your conference, it was your regular board meeting.
Yes.
Last Thursday, and appreciate your bringing it to our county. I did not know that you had so many different kinds of reports that you had to do. I saw a number in the thousands of the reports that you have to complete. Amazing, amazing. But thank you so much. Mr. Ed, you want to say howdy?
Yes, I do, and want to thank Sean and Ann, and you can tell Ann has a passion for what she does, and we're always excited to hear from her. But I also wanted to point out that you mentioned Chris, and Chris is probably there this morning.
He's here.
Chris is the vice chair of the board and will probably eventually become the chair of that board. And we have two other members on that board also from Cumberland County, Dr. John Griffin and Lotus Gloston, who is chair of our local board here. So, and all of them play an important part in the Alliance, and so we're very proud of what they do. And you've already mentioned Chris, but I wanted to mention John and Lotus also.
All right. Thank you. Thank you so much for coming. We look forward to a continued good working relationship with you.
Thank you.
Thank you, Chris.
Question?
A question. Oh, I'm
Yeah,
sorry.
can I ask a question? real
I
quick?
am so sorry.
I have one for Sean and then one for Ant. Sean,
Yes, sir.
you mentioned in one of your early slides, and I just want to get some clarity, that you have 180,000 cases.
Medicaid covered lives. And so what it should
So that's
say-
one person, 180,000 people, not 180,000 symptoms.
Correct. So
Okay.
you should have said that roughly at any given time, about 8% of that population is accessing some of our services.
Well, if we're at 1.7 million, it's actually over 10%. I mean, so,
Right. I'm sorry, so I meant that of the, there's 180,000 Medicaid covered lives. I was saying of the people who have Medicaid at any given time, about 8% of people with Medicaid in the 4 county areas are accessing our services. So I'm not exactly sure what the penetration rate is for the general population.
okay, and all these 180,000 are mental health patients.
No, 180,000 just have Medicaid coverage.
Okay,
So of that 180,000, there's only a percentage at any given time that are actually using our services
okay. Still 10% of the population, pretty much.
of the Medicaid
Yeah,
population.
of the
correct?
Medicaid population. All right, good. Ann, I have a question for you. We have, Cumberland County, I feel, has done a lot of things aggressively with mental health in the last year, with our relationship with the hospital and our CIT program. We were very well aware when Mr. Debney and we first started talking about the CIP program that Wake County had a program also. I'm curious, how the two programs, are they going on similar paths, or are they going on different ways, and is the Alliance able to encourage us with some best practices of both on the program? Because I'm a big fan of, care instead of containment in a jail setting or an emergency room. So are best practices being used? Are we able to take anything that Wake County's doing to make our service a little bit better?
We actually are having some conversations around what a jail continuum could look like in Cumberland. I mean, there's definitely some strengths of the Cumberland CIT program that even Wake doesn't have. The number of officers that are trained, the people that are diverted out of the jail into treatment is really impressive here. Some of the things that we're exploring with the CIT partnership here, we actually started a CIT steering committee that includes EMS. And so we're looking at community paramedicine programs that would even create behavioral health urgent care centers as alternative drop-offs to the emergency department. We're looking at post-release programs for people that have high recidivism into the jail. We're looking at kind of what mental health substance abuse services need to be offered in the jail to stabilize somebody so that when they're released, we have more of a comprehensive plan of housing and employment and benefits. And there's the diversion program that currently is operating in the jail system, but it's slightly disjointed now. I mean, so we're looking at the communication and coordination from the time of booking to the time that we're made aware that somebody is self-reporting mental health conditions. So the answer to your question is I think there's a lot of strengths with the Cumberland CIT partnership, and at the same time, we're looking at kind of along the continuum what pieces of that are missing, or what pieces of that we could leverage for other types of opportunities for more high-risk populations.
Thank you.
Thank you. Are there other questions? I'm sorry. Mr. Evans?
Quick questions, two combined here. As far as your transitional housing, My Rover Reese, I was glad to hear you mention that particular facility, but let me ask you this in regards to it. Is it being funded up to full capacity for residents to reside there? At one time, there was a problem as far as funding was concerned with My Rover Reese. So is that pretty much worked out?
Yes, sir.
Okay. And the other was homelessness you talked about. What programs or what is being done here in Cumberland County to combat homelessness for all individuals?
Well, speaking for people that are homeless that have mental health and substance abuse issues, which the vast majority of them do, we have a housing specialist, William H. Robinson, that is on our staff that works a lot with our housing partners, that works on the Continuum of Care committee that looks for HUD funding, and the nice thing about kind of our coming into this partnership is that there's a more community approach to deciding what are some of the important housing options for people that have disabilities, whether it's a Shelter Plus Care voucher program, whether it's more street outreach to identify people that are chronically homeless to bring them into housing types, whether it's a supported model that has some more intensive recovery services built in. So there's lots, kind of like everywhere, there's lots of good things about where Cumberland has invested their money for this population, and every year we have a point in time count to look at kind of shifts in homeless families, and we've been doing a lot of work in the school system to identify services for students that are currently homeless. Our rental assistance money does cover families who are currently homeless, and so part of it is just making sure that we identify those who are in need and we partner with others to provide the best housing option that we can. But there are definitely some programs that are funded by HUD that we are interested in for the Cumberland area.
Thank you so much.
Thank you. Thank you so much.
Madam Chair, if we
Item
could,
7.
we'll go back to item number 7, which is consideration of a request of Round Point Asset Management, Inc. for a second stay of demolition, order entered April 22nd, 2014. And I would again call on Mr. Moorfield, please.
Madam Chair, Commissioners, Mr. Herrera, I think, appeared on July the 7th at a special meeting at which I was not at and was not aware that this issue was even on the agenda, that it was one, or that it would be the create the questions that it did. So I drafted the memo. I hope answers the questions that some commissioners had about the process by which we mesh demolition and foreclosure actions, and we typically don't do that, but I hope that this memo explains the sort of convoluted nature of this particular process and why I did advise the minimum housing folks to go ahead and pursue the demolition order, which they did sometime after January, or probably late January, started really in earnest sometime in January of 2014. In this particular case, this property had been, what I've done is just give you a list in that chronology of the things that either the county or Round Point has been involved in. I didn't give you an entire list of all the bids that have been made on this property. Literally, this foreclosure file is a couple hundred pages thick. This has been going on for over a year. But in any event, that list does provide the information as to what has happened in this particular case. My recommendation to you, and this is based on actually a site visit, I am recommending that the board grant another stay of this demolition order until October the 20th, 2014, but it's subject to the 6 specific conditions I've listed there. That the grass be kept to a height of no more than 4 inches, all shrubbery be appropriately trimmed, and the exterior surface of the structure be kept clean and free of mold or mildew. I point out that on October the 1st, those 3 items were in compliance, but I think the compliance had been attained perhaps the day before. But Mr. Herrera did not know I was going out there anyway. The lawn be kept clear of all trash, debris, and store items. There's only one item, and it's not visible from the road at the back of the house that this would be simple to remove. It appears to be an overhead projector or something. But this is pretty important, that the dwelling be secured from entry by persons or animals, with all missing garage door panels being replaced and all foundation vent openings being secured by grills or blocked. I think that may be a health issue with some feral cats. There may be some issues with that, but in any event, the garage doors, there are some panels that are completely eliminated.
There's some what?
Panels. It's a
okay.
panel garage
I
door, and there's some that are just completely gone. And of course, that the dwelling shall remain uninhabited. I believe, and I've made those specific recommendations because I think that is a reasonable expectation of the adjoining property owners. If the board sees fit to grant this additional stay, then I will determine before October 20th if he's in compliance with these things. He can very easily take care of these things, and whether Diener has made a permitting decision. And I'm making this recommendation because Diener did in fact go out there on on September 30th, I think, and do a site evaluation for an alternative treatment system that he has proposed. I was skeptical of that until I actually went on the site. The way this lot is laid out and the available space, it is possible that type of treatment system could be installed on this lot. If so, it is I believe it will be the first one that Diener has permitted in this part of the state. There are some scattered around the Piedmont and the foothills. So I'm interested to see if they'll permit that, because this may provide an alternative solution to some other issues we have in some other subdivisions. So I'm looking at this from a broader picture too. And I'm only recommending this extension to October the 20th for the simple reason that if you look at the chronology of things that happened at Round Point, which is Mr. Herrera's company's been involved in, if you give him 30 days, he'll wait until 29 days to do whatever he's going to do. If you give him 6 months, he'll wait till the day before that. So I'm pretty serious that we need to, my recommendation is that we just follow this along and hopefully we can get a resolution from Diener as to what they can do by October the 20th or soon thereafter. But I think this was a clear message to him that the board's serious that he's got to satisfy reasonably satisfy the adjoining property owners with the way he's keeping this structure up, and that's my recommendation.
Our next meeting is
October 20th.
Is October the 20th. I didn't like that, or soon thereafter.
Well, we got to have a specific date to stay the execution, I mean, if the board wants to go further, that's fine, but I think this is the only way that we're going to make
Okay.
sure that he takes care of this stuff is to stay on it.
Madam Chair. Madam Chair, I've been very involved in this, and personally for me, I think that the county attorney's recommendation of a stay till October 20th is reasonable. Mr. Herrera has had meetings for an alternative type of septic system. My heartache has been that this has been going on for 10-plus years with the neighbors, but if there is a solution, I would make a motion that we grant a stay of demolition order until October 20th, 2014.
Second.
All right, it's been moved and seconded that we grant the stay. We're ready to vote on this. Those in favor? Mr. Edge?
Unanimous?
All right. Thank you. Don't start on the 19th. The 20th is the drop dead date. All right. All right. Drop dead date on the 20th.
If I may,
No,
the state.
no, baby. Thank you. Next item.
Item number 8 is nominations to boards and committees.
Mr. Fairclough. I'm
Madam Chair-
sorry, but we've
Madam-
been dealing with that for several years.
Yeah, we have.
I'm sorry. Several years, and enough is enough. Next.
Madam Chair, item 8A is nominations for the Cumberland County Library Board of Trustees, and at this time, I would place in nomination the names of Paige Ross and Brian J. Tyler, both of whom have been recommended by the Library Board of Trustees.
All right. Thank you. If there are no other nominations, we'll go to the jury commission. Should be 2 nominations for the jury commission.
I believe it's 1 vacancy.
Just
One vacancy. I'm looking at the nursing home. If we're not ready,
I don't have a nomination.
we don't have a nomination
I
for the
don't.
jury commission. Let's go to item C, the Nursing Home Advisory Board. I'd like to nominate Tom Lloyd and Clyde Hammond. If there are no other nominations, we'll go to Mr. Edge with the appointments to boards and committees.
Thank you, Madam Chair. There's an equal number in all of these. I'll just go ahead and read them. Christine Thomas is to the Juvenile Crime Prevention Board, Juanita Baker, Louis
Second.
It's been moved and seconded, and that these people be reappointed. Those in favor? Mr. Edge?
Unanimous.
All right, and that is unanimous. Item 10, before we have the closed session, thank you for joining us. To the members of the audience, our next meeting will be the 20th, October the 20th. We do have public hearing on the 20th. But thank you so much. And you can feel free to stay, but we're going into executive session. All right. For an economic development matter pursuant to NCGS 143-318.
Madam Chair, we don't need the attorney-client. I just verified with Rob. So we
All
just
right. A4.
So moved.
Second. Those in favor? We're in closed
Unanimous.
session. God knows. James Lawson.
Is Ken going in there with us?
Yeah, you got this.
Okay.
Let me speak to the people.